Greetings and welcome. Happy Friday. This is Diva RD bringing you news you can use on my new YouTube channel entitled Beyond Culture I Am. How are you? Oh, I'm so glad it's Friday. I'm glad to relax and have a few days off, and we get an extended weekend because it's holiday. It's Martin Luther King Day on Monday, so I'm glad about it. Got lots of stuff to do, and want to continue on with our 21-day challenge. This is day 5, and this morning I got up and I did another step class that was pretty intense, but I enjoyed it, and I can feel the difference when I exercise versus yesterday not being able to exercise because I got up late. So I am excited. That's my challenge, to get in as much cardio as I can on a daily basis to ensure that I am burning calories and maintaining a healthier you for 2021. So again, as I was driving into work this morning, I heard on NPR the updates on the new strand, the variant, which is quite interesting. It gets quite interesting every time I listen to it. But I want to share with you that there was an interview this morning with a Dr. Redfield, who is about to be leaving the CDC, and he is considered a director, I think is the appropriate title for him. But he was saying this morning that there are some huge health disparities among people of color and for those who have coexisting disease states such as diabetes, obesity, chronic kidney disease, just to mention a few. So I am encouraging you to make sure that you practice the safety recommendations and instructions that have been put in place. Wash your hands. It was cited this morning on NPR that we have gotten comfortable with, and I should say comfortable, but we've gotten slack, and we're not washing our hands as much. And so if you are not washing your hands as much, it means that this variant that already has been predicted to have a higher transmissible rate is going to be even higher if we don't practice those safety precautions that have been put in place per CDC. We're not wearing our masks, and I'm not sure why that is. I don't know if we don't believe that this is truly a pandemic and that the lives that have been taken are truly lives that have been taken. So I'm encouraging you to take the time to listen, but first and foremost, be ready to protect yourself and respect others. This is a pandemic, so it's going to affect us nationwide, globally, the whole world. The UK now is experiencing some rather startling trends where they're having increased numbers of the virus, and the new strand is there, and it's working, it's doing its thing. So let's not give in to the idea of, it's getting better and I can kind of be lax and free about it. Let's also believe that it's going to get better, but let's believe that we have a role to play as a citizen, as a part of the community, as a part of the world, as a part of the pandemic. I am encouraging you to make sure that you wear your mask, that you practice social distancing, that you make sure that in the midst of all of this, you're not depriving yourself of sleep, that you're getting in some physical exercise, that you're maintaining good nutritional intake, that you are boosting that immune system. And I'm not suggesting that you boost it with all kinds of over-the-counter aids or whatever those recommendations are, but I mean good solid nutrition, making sure that diet is 50 to 65% carbohydrate, 20% protein intake on a daily basis based on for the most part 3 meals a day, and your fat, let it be less than 30%. Increase your water intake. Make sure you're hydrating your body, your cells, and maintaining from that perspective. Intake of vitamins and minerals. We can get a lot of that from selecting good food choices, fresh fruits and vegetables. And make sure that you know that all of these things are going to promote good mental health as we strive to move through each day, looking forward to the day when we'll be able to get back to a, quote, normal. I believe, though, this is a new normal, and that as we approach the upcoming months with the new variant on sight that we really need to make sure that we are concentrating on making sure that we're playing our role in this whole scheme of things of the COVID-19 pandemic. This is serious. It's very serious. And if you didn't believe before that it was serious, it's truly serious now, especially with the new variant. The variant, and as I said yesterday, has the ability to be more transmissible, not necessarily deadlier, but more transmissible. But over a period of time, if it's going to transmit at a rate faster than the first one, then that's going to mean one or two things. It means that we're going to have an increase of those who are asymptomatic. So you may be very well standing by someone who doesn't know that he or she has COVID because they don't have the symptoms. So that's why it's important that we maintain social distances, that we're wearing our masks, that we're not touching our face, that we're using hand sanitizers, but first and foremost that we're washing our hands on a regular basis. The rule of thumb is, I think it is that if you have used hand sanitizer 3 times in a row throughout the course of the day, that 4th time you should be trying to find soap and water to make sure that you are getting in a good lather and you are washing your hands on both sides and in between your fingers, and just making sure that you're ridding those hands of anything that you may have come in contact with that has potential to be contaminated. So I can't say enough. From a nutrition standpoint, it's very important that we watch our nutritional intake, because as we approach a new phase of the pandemic, COVID-19, it also tells us that we may be at risk for being in quarantine, if you will, or going back to just being isolated, if you will, with a tight belt on social distancing. So that means for the most part that we're going to slightly be depressed. We may even have a whole lot of time on our hands and we just don't know what to do. So let us not get caught up into feeding our feelings. So if we're not feeling very well, let's not consider taking it out on some junk food. So let's make sure that as we move toward these next couple of months, which are going to be a trial of the test, we're going to make sure that we are making good food choices. And for those of us who are at home that have children, incorporate that as part of your daily plan. Let that be a part of your plan with your kids, including them in the process of selecting healthy meals, preparing those meals, getting in physical activity. The days are getting slightly longer, so there's some physical activities that can be implemented and put into place. Go for a nice brisk walk. You can do it early in the morning as time allows, or you can do it early afternoon as time allows, but just make sure that you're getting it in. And let it be a part of your 2021 day challenge of making efforts to become a healthier you. Again, this is day 5, and I'm challenging you to make all effort to become a healthier you. Even in the midst of the pandemic, trust me, it can be done, but there is a role that we have to play. We have to take care of ourselves, and we have to make sure that we are respecting others as we protect ourselves. So as I close, I say again, thank you and welcome to my new YouTube channel entitled Beyond Culture I Am. This is truly news that you will be able to use. This is again Diva RD bringing you information about food, culture, and nutrition. So until we meet again on day 6 for our 21-day challenge, I say to you, happy Friday, enjoy the evening, relax, get in some fun and excitement, and protect yourself as you respect others. Have a great night. Wow. Ciao.